lot of ties in the hearse. I've been on a vibe, kinda hard to describe. I'm in between, I'm good and it's fine, but I'm tired of the grind. Then I come alive in the night to realize I'm in the middle of the time of my life. I'm never so packed for the stack, never lied on the rap. Got a bag from the way that I write it. Queen Lincoln Tyson, do that ass survive, doing 80 to the house. Then I hit it to the sky, change haters on the tideway. Talking to the grip in the face, be still, let that hit stuff fade. We all with the same, we all want a meal in the safe. I wanna live like I'm trying to lightning. Trail spill from my lips, feel bent from the bib. Take a sip till I pass out. Try and get grit, but it don't make sense. Cause you can lose life on this fast route. Yeah, turn thoughts to a cash cow. I might flip that to the glass house. I don't need the accolades, I'm in love with the chase. I just wanna eat, save a spot at the table. Beats with the slap, hit myself on the map. Long with the wind, but knowing that it's cap. 5-hour flights, couple nights at the flat. To be real, can you see me making moves while I'm at? I'm still on the grind, limit time when I chat. Burning down sage, keep the demons away. When I write it, give a piece of myself to the page. I don't do it for the praise, love, that's just how I'm made.
Truth in the glass in the mirror. Yeah. Do it at me, old man, tryna pass in the fear. You're the first one to talk, but the last one to hear. Eyes blurry, but I couldn't see the ass, and he cleared down. Start to feel like I'm on one. Settle in, I'll be here for the long run. I'm a slave for the cash, got snakes in the grass, no brakes on the ad, but it's all fun. We done seen it all, heard it all. Heard enough, give me space before I murder y'all. 10 bad bitches here, I'ma curve them all. 12 missed calls, and I still made a curtain call. Here to light it up, lighten up. Hear him talking, they ain't right enough, tighten up. Everything that I came for, I left with. I don't bang sets, I just bang on the set list. Going past supper when I came for the breakfast. Put me in your prayers, I might put you on the guest list. Young niggas in the reckless, gold in my soul, got the same on my necklace, bitch.
Welcome. It is Friday here in Charleston, at least. It is 12 p.m. Eastern time. It is that one time each week, one place. Now it's soon to be two places, but going to be two places. That is Ask Dr. Geier Live. Very, very excited to be here wherever you're watching. Whether that's YouTube, whether that's Twitter, that's Facebook, I hope you're making today your masterpiece. I say that it's one of two places because later today, in fact at 12:30 Eastern Time, 30 minutes from now, I'm going to try this on Instagram. So I am starting to dabble more into short form videos on Instagram and YouTube Shorts and TikTok. And I am trying Instagram Live. So I'm going to do the exact same thing. Answer questions just like I do here. Just like there, same thing applies here. I am not giving you medical advice. Even though I am answering your question, it is for information and educational purposes only. I haven't seen you, examined you, looked at x-rays, looked at MRIs. I'm not your doctor. You're not my patient. I'd love to be, and if you want more information about that, I'll talk about that at the end, or you can go into the description below. And if you're wondering who the heck is this guy talking and how does he have the right to answer orthopedic questions? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you look, feel, and perform your best regardless of age or injuries. Really excited to be here today. Jagdies, good to see you. I am glad you're here. I apologize if I'm not saying that right. I know you've been here before, but very excited to see you. We've got somebody here that's in sports medicine. I can't wait to talk a little bit about that. I am very good. I hope you're doing well. Let me see if I can make these bigger. One of the beauties of eCam is I can do all kinds of cool things on the screen. Kaylee, finally get to watch one of your live videos. Always miss them because of the time zone differences. Yeah, I know. And it's one of the things that I've toyed around with. And I've thought about moving this to 5 p.m. on Thursdays. I can't do 5 p.m. on Fridays due to some other obligations. But I've thought about doing it on Thursdays at 5 p.m. like I used to do Better Than Ever Live. But it was there were too many things in my practice that risked messing it up at the last minute. We may tinker around with that at some point. So just know that I'm not 100% dead set on noon at 12 p.m. Eastern. I do like it at noon, my time, because it's basically the end of my work week. I work like crazy Monday through Thursday and Friday mornings. Then I take Friday afternoon off, all day Saturday off. some parts of Sunday, but I do a lot of times do some work on Sundays. So Sunday through Thursday or through Friday afternoon. And so it's a nice end to my week. I get to help people, which is what I really love to do, as the last work I do of every week. So that's partly why I do it. But then we have been talking about tinkering around with that. All right, let me start here. I'm going to do this a little out of order here. Where was it? There he is. Just because you've been here before, and I don't know. Like I said, I'll get to some other things. Had ACL surgery 43 days ago. There's pus discharge from the surgical wounds today. Again, I'm not giving you medical advice. This is just this is what patients, really any surgery, but certainly ACL surgery, need to kind of think of. One, and I count myself fortunate because I've probably done over 1,000 ACL surgeries. Now I don't really operate that much anymore now that I've moved on to anti-aging and regenerative orthopedics, but I have probably done 1,000 ACL surgeries in my career, and I never had one get infected, so I was very, very fortunate. You can have an infection through no fault of yours as a patient or the surgeon. I mean, allegedly, I don't know this for a fact, but it seems to be fairly well known in the orthopedic sports medicine world, Tom Brady's ACL got infected and needed another surgery. Allegedly. I don't know that firsthand, but that's the story everybody tells. So it can happen. Here's the thing. If it's just a pus under the incision, it could just be a little suture or stitch abscess that's draining, and it's not a sign of a deep infection, so certainly good. I typically would be fairly aggressive about that as the physician. I would ask, if I had a patient that had that, I'd say, hey, come let me look at it and see if you need to be on antibiotics, or if it's a sign of something deeper in the knee that potentially needs to be washed out. Because again, you've got a graft you're talking about, depending on how it's anchored, screws or buttons or something holding it in place, and you want to treat that infection, try to clear that infection before it basically destroys the graft and leads to other issues in the knee. Again, in your case, I haven't seen, this isn't advice because I haven't seen you. Hopefully it is not nearly to that point, but that's what I would be thinking as an orthopedic surgeon, kind of my thought process. Hopefully it's very early and it doesn't need much, maybe other than an oral antibiotic, but certainly you do everything you can to prevent it from actually being what's called an intra-articular infection, an infection inside the knee. That becomes a much bigger problem. All right. 113, and you may at some point have told me your name. I apologize. But anyway, for lack of knowing that, started sports medicine residency today. First match last Friday. Women handball regional championship. That's cool. I've never gotten to take care of a handball team, tournament, competition, anything like that. It's really cool though. I used to love actually college and pro sports. I don't miss it at all, honestly, for reasons beyond the scope of this, but I did enjoy it at first. We were there with emergency. It was awesome. Please recommend some, where'd it go? Books in sports medicine. So one thing that makes that a little tricky is I don't know if you're orthopedic sports medicine, meaning an orthopedic surgeon that's going to be doing the surgeries, or if you're some form of primary care sports medicine, whether that's a background in pediatrics or family medicine or physical medicine and rehab or things like that, where you're doing more of the medical care. Yes, you're evaluating orthopedic injuries, but then if it needs surgery, you'd pass it on to the orthopedic surgeon, because the books would be fairly different. In the orthopedic world, which is mine, orthopedic sports medicine, and what one of my 3 board certifications is in orthopedic sports medicine, there are some textbooks. DeLee and Drez is the sort of one that's probably best known. Campbell's Operative Orthopedics, where I did my orthopedic surgery residency, the Campbell Clinic. They write a 4-volume, at least it was 4 volumes, it may be bigger now, master textbook of all of orthopedic surgery. The sports medicine section is very good in that. There's a number of others, Neil Elatrash and Jimmy Andrews, and there's a lot of different books. I've written chapters in a couple of different books, so I don't know that I have a specific one. I'll be the first to tell you, I don't know necessarily the primary care sports medicine textbooks. What I will say is over the last 10, 12, 15 years, I really got away from textbooks because by the time they're published, they're already largely out of date. They were written 3-4 years ago, and it just took that long for the editing and the publishing. So I got really over the last 10, 15 years, I just read the journals themselves. The American Journal of Sports Medicine is thought to be probably the most well-respected of the orthopedic sports medicine journals. The Orthopedic Journal of Sports Medicine, also very good and free to everyone. When you're looking at primary care sports medicine, I would talk about 2 journals. The British Journal of Sports Medicine and Sports Health, I think, are very good for what that's worth. Very, very cool. I can't wait to hear your progress. And I think I saw on here a second ago, wrote to you on LinkedIn. I'll be the first to tell you, and this, no offense to you or anybody else, I don't do LinkedIn very much, quite honestly. I get too many people that reach out trying to sell me stuff, so I just don't. I get 3 or 4 messages a day. They're almost always sales related, and so I don't do that a whole lot. All right, let's see. Priscilla, how do you feel about medical marijuana? All right. I will be the first to tell you that I don't know that much about it. I have not had any need or use for it in the orthopedic world. I will tell you that I know pro athletes, especially former pro football players. There are a number that either use it or push for it, and there may be some sound truth to that. I don't know the research behind it, and I say that not from an ethical standpoint or anything else. I feel like all of these potential treatments are worth looking at. And I think the opioid crisis is real, and we need to get people off of painkillers, specifically opioid medications, because they become very, for lack of a better term, very addictive and very harmful. Having said that, I just don't know the literature for medical marijuana, best routes of administration, which diagnoses it helps the best. So unfortunately, I'm probably not the best person for that. I'm, again, not opposed to it, and it may be great. It's not something I typically need in my practice, and so I've never really explored it. Aloy DeLuna, if using BPC 157 on a shoulder for 20% tear, how long to see results? Couple things. Depends on what tear: labral tear, rotator cuff tear, biceps tendon tear, subscapularis tear, lots of things like that. Generally, there's 2 things I want to say about BPC. One, everybody's going to respond differently based on how it's given, oral versus an injection you give yourself, how close that injection is to the site of injury, how bad the injury is, are there coexisting issues going on? There's a lot of factors. Typically, I've seen people for various things get somewhat better in 2 weeks. I've seen people take about 8 weeks. The other thing, though, that I'll say, because I get at least 1 or 2 people every single day that reach out to me through my contact form, and the link to that is in the description below if you want to potentially make an appointment to see me, that say, hey, I've seen you talk about BPC. I want to come and see you as a patient and potentially try BPC. Here is my experience, and I'm actually going to do an entire video, long form video on YouTube this week or next week. I'll record it next week, so it'll probably be the week after that it's posted, about combination treatments. And here's the thing. Whether it's arthritis, whether it's a muscle, tendon, ligament injury, those are complex, they're complicated injuries. There's usually more than one factor. In arthritis, it's the breakdown of the cartilage in the bone. It's the inflammation. It's the need to strengthen and support the other structures in the knee to take pressure off the damaged area. And it's also the lack of cartilage and bone that needs to be rebuilt. And if you only address one part of that, you're going to get a little bit better, but you're not going to get significantly better. I've been very and that goes true with if it's a tendon or ligament tear or tendinopathy. I've been, I don't want to discourage people, but I've been really underwhelmed with peptides generally. I do feel that they're helpful, and I've used some myself, but I feel they're somewhat helpful. I think they're badly oversold online, and I've said in many videos, go check those out if you want to see why. You should not buy peptides online. I can go on and on. I think it's terrible. But a lot of these people just online talking about they're the best thing ever, they're a game changer, usually have a financial incentive to do that. They make money on peptides, either an affiliate fee by promoting some site selling peptides online, or they're selling them themselves. And so I'd be very leery. I do feel that they can be helpful. I haven't seen many injuries that bang, BPC is all somebody needs and they're good as new. I haven't, maybe delayed onset muscle soreness. I have a friend that says that it helps really well with that. I don't know. I've never tried that, but she swears by that. Having said that, I do feel that BPC, along with a number of other things, can make people better, but as a comprehensive treatment. And it depends a little bit about what the injury is, but I mean, you look at other peptides, you look at medications like penisin polysulfate, you look at efforts to restore cartilage, bone, tendon, ligament, whatever the problem is, platelet-rich plasma, exosomes, things like that. And there's a number of other things, shockwave and hyperbaric oxygen. And that's where I feel like you have really good results. And I've been doing this now 18 months. Again, I have 3 board certifications, so I know this. And as far as I know, I'm only the second orthopedic surgeon that has that board certification in anti-aging and regenerative medicine, at least here in the United States. So I feel that I know what I'm talking about. And what I've seen with my patients over 18 months is the combination and using a lot of those different treatments works far better than any one. Again, not to say that BPC can't be helpful. If it was a family member of mine, I would not tell my family member, that's all you need, that one thing. And it doesn't have to be anti-aging stuff. It's things like physical therapy, and it's things like adjusting your weightlifting or whatever it is until it gets better. There's lots of components to this. But that's my thought process and why you're going to hear me start to say, yes, penisin can be helpful, or yes, BPC can be helpful, or yes, maybe thymosin beta 4 or exosomes, but alone, they may not get you to 100%. And a lot of times, if you're not at 100%, you're not getting back to what it is you love to do. So, and that ultimately is our goal. All right, let me do a last couple of questions. Yeah, Dali and Drez. Yeah, it's big. It's a 2-volume. It's long, but I remember reading it cover to cover. What was it? My 4th year in residency, and referred to it a lot during my sports medicine fellowship. And Aloy says, yeah, subscapularis tear, one of the rotator cuff tendons in the front of the shoulder. Definitely understand. All right, Isabella. Fell on my knee 2 weeks ago. It's improving. Still feel weird pain. Full range of motion. Can bend it all the way forward and back. Hopping on it hurts a bit. Should I be concerned? It's hard, again, and I say this not to be critical. Without examining you, it's hard to know. Typically, some of the signs I tell people where, all right, maybe you get concerned with a knee injury. Significant swelling. A little bit of swelling, maybe not such a big deal. Significant swelling, usually not normal. The knee is stuck in a certain position, or it gets stuck and then you have to twist it to get around, what we call locking, or the milder form, catching, potentially a sign of structural damage. Your knee giving way, literally the tibia shifting out of place from under the femur, like an ACL injury, would be something conservative or something concerning. Others, those are kind of the main ones. Then you get, this is not a hard and fast rule as to, is it getting better over 24 or 48 hours or things like that. Another one is if you can't put any weight on it at all, again, and I'm not saying you, just anybody, that would be another one that I'd probably be fairly concerned about. All right, that looks like it's it. I am going to head off in a couple minutes here to Instagram, so I will stop with questions today, but I will be back later this week to do this again and multiple times throughout the month. One thing I want to say real quick is we are looking, if you have a knee injury or knee pain, we're looking for 5 patients that want to get significantly better in the next 30 days. No surgery, no cortisone shots. If that potentially interests you, go into the description below. There is a link that gets to my contact form on my website. Fill that out, name, email address, phone number, and in the description box, all you have to type is the word interested, and me or my assistant will get back to you with a little bit more information about that. We're really excited about this protocol that's really helping people get significantly better in as early as 30 days, even though they continue to get better well past that. And we'd love to help you with that if that's something you're interested in. As always, very, very grateful for all of you that join, some repeat joiners, some first time. If you are on Instagram and want to join me there, I will be there in 13 minutes. It may not go well. This will be the first time, and I don't get to use this fancy setup studio because for reasons that I'll talk about a little bit on Instagram. Hopefully that's coming where I can put stuff on the screen like I do here and all that. But today it's just going to be me looking at a camera, trying to answer questions, and just honestly flailing and seeing how it goes. Very, very excited. I hope you have an amazing, amazing weekend. I look forward to seeing you next time on Ask Dr. Geier Live. Have a great weekend.